I'm the Air Quality Programme Manager for Camden, but I'm also one of the lay members for the Committee on the Medical Effects of Air Pollutants. So I provide a bit of a local authority perspective in supporting COMIAP with its work to try to provide guidance about how air pollution affects health. But in this capacity today, I'm purely representing my role in Camden, where we are trying to improve air quality to protect public health. So I'll start by giving a bit of a background as to what local authorities are expected to do in relation to air quality in the UK. It's all defined in the Environment Act 1995, so it's a piece of legislation which is 30 years old. But there's quite clear and frequently updated policy and technical guidance which dictates what local authorities and other types of local government need to do about air pollution in the UK. So in a nutshell, we have to measure air quality and determine whether or not we exceed the legal limits for pollutants in the UK. And where there are exceedances, we have to create action plans, we do monitoring, we do annual status reports, effectively design a programme for trying to meet the legal limits where we measure exceedances. The limitations of this, unsurprisingly, are the fact that, firstly, as I said, it's a 30-year-old piece of policy. So our understanding of how air pollution affects health and the nuances of that and the environments in which people are affected has evolved a lot in that time. Part of the problem is that air pollution has always historically been tackled as a bit of an environmental problem rather than a public health problem. So there's a lot of effort expended on measuring the concentrations of air pollutants in outdoor air without necessarily thinking about whether or not that air is the air that people are breathing on a daily basis for the majority of their time. One of the issues as well is the fact that the legal limits of pollution in the UK are quite restrictive. So we focus on measuring the mass concentration of different types of pollutants. And we've already heard from Douglas earlier on that there's a lot of evidence now about the fact that really tiny particles can potentially be more damaging for health just because of how small they are, enabling them to enter further into the body where they cause more damage. So a restrictive approach for measuring and understanding the severity of air pollution doesn't necessarily help us drive action to improve public health from the exposures to bad air quality. And the statutory framework only really covers outdoor air. So we've heard already about 80 to 90% of time is spent indoors, but we're focusing from an air quality regulatory perspective on an environment that we only spend maybe 15% of our time in. So there's a mismatch, I think, between what the regulatory framework says we have to do, but what we think might actually be most consequential for people's health. In terms of other climate hazards, so I don't work in the climate team in Camden, but we're lucky that in Camden we have a very closely related air quality and climate programme, and that's been hugely useful for us. The response to climate hazards is, I think, a bit more fractured and it's less clear than for air quality. In terms of flooding, it's slightly easier, I suppose, than for heat. And local authorities effectively are the lead authorities for managing flood risk. So we have to look at where there is increased risk of flooding. And in Camden, we have various parts of the borough where there is a really quite high severity of flooding events if there is extreme rainfall. And we have this every couple of years now. Unsurprisingly, the frequency has been increasing. But it's heavily dependent upon there being really effective partnership working with the water companies and sewage companies, but also other stakeholders that perhaps have responsibility for catchment areas and for reservoirs and ponds and that kind of thing. And in Camden, Hampstead Heath is managed by the City of London Corporation. So it's really contingent upon there being really good partnership working between a range of different authorities. But I said already that heat is more challenging than water. And as far as I'm aware, there isn't really a clear framework for who has responsibility for dealing with heat risk. I think there's lots of different authorities that have some degree of responsibility for it. You'll find, I think, a significant divergence between local authorities, where some of them, Camden included, will have plans for looking at adaptation and resilience in a climate sense. And that would include having a plan for responding to extreme heat events. So it might be working with the council's emergency planning team, with public health services to get information out there to support the most vulnerable in our communities. But in some other local authority areas, there won't be plans like that. So there's a significant disparity from one area to the next. And in Camden, you can see that there are parts of the borough where there is a very significant level of heat risk and parts of the borough where there isn't so much of a risk. If we were to overlay this map with indices of multiple deprivation, unsurprisingly, I think you would see that the areas with the highest risk of susceptibility to heat are also the most deprived parts of the borough as well. So it's that idea again that environmental risk factors are disproportionately affecting more vulnerable people in society. So just returning a little bit to air quality, which is sort of the main point that I'm focusing on today. So Camden is a very densely populated borough of just over 200,000 people, and we have just over 100,000 households in Camden, and an approximately equal split between socially rented, privately rented, and owner-occupied properties in the borough. So there's a lot of properties in Camden that are managed and that the council is responsible for maintaining them. Historically, it's been a very polluted place, partly because of the density of population and how homes historically would have been heated, how power was generated in London. But we have a lot of major roads running through Camden as well. So the Euston Road has always been one of the most highly polluted air quality monitoring locations in the UK. So anyone who's looked at the top 10 rankings for most polluted monitoring sites in the UK will have always seen Euston Road right up there, if not at the top. So because of that, the entirety of Camden is an air quality management area for NO2 and for particulate matter as well. So that dictates that we have to have air quality management plans and do annual reporting that I talked about earlier on. And the fingertips data from DHSC suggests that just under 10% of all mortality in Camden is attributable to long-term exposure to particulate matter air pollution. So we have quite an acute problem that air pollution is very actively, as far as we understand it, causing a lot of mortality in Camden, and that's above the London average and the UK average. But it doesn't affect everybody equally, as we're getting into today. So when we look at asthma prevalence in Camden, and we use asthma a lot because it's one of the more prevalent health conditions, and so the statistics are more useful and more valid, generally speaking, we can see that there is a huge disparity when we look at one part of Camden to another part of Camden in the prevalence of asthma as one of the conditions which is associated with exposure to air pollution. And again, if we were to look at indices of multiple deprivation affecting children, we would see that the dark green parts of Camden, so Regent's Park and St Pancras and Somerstown, Gospel Oak up here, and bits of Kilburn, the bits which have higher prevalence of asthma among children and young people are the more deprived parts of Camden as well. And it also manifests in access to mental health services for children, in the number of children with asthma when you look at it categorised by decile. So this is a different data set, but showing effectively the same thing. Obviously, children with asthma, children with other health conditions, where we think there is some association either with air pollution or with the household environmental conditions, children are more likely to miss school, or they're more likely to struggle with how they perform at school. So it's not only about health, but it's about how children do at school, and that has huge consequences for their life chances as well. So it's not just about health, but economic and sort of educational outcomes as well. So this is from a fairly recent piece of work done in Camden with Institute of Health Equity at UCL that looked at the changes from 2011 to 2021 census and how the impact that we'd seen from the changing socioeconomic circumstances in Camden on children's health and well-being in the borough. And the findings are pretty stark. There is obviously a huge amount of work going on to improve air quality at all different levels of governance and action. So I've not even included on here the sort of community work, but I think a lot of the positives for air quality in the UK have been driven by grassroots action and advocacy by groups of parents concerned about air quality in the vicinity of their children's school, or people concerned about what their neighbour's burning at home. But regulatory framework itself, I've listed some of the issues with it, but it has also driven a lot of action to try to improve air quality as a significant problem for public health. Pieces of legislation like the Clean Air Act have enabled local authorities to take some action to try to limit some of the sources of air pollution. And at regional level, things like clean air zones, so in London, the low emission zone and the ultra low emission zone have been instrumental in accelerating the transition away from really polluting older vehicles towards cleaner ones. There are always some downsides with this, so it always has to be looked at from the perspective of what has been the sort of the equity impact and whether certain people have been financially disadvantaged by these schemes. But ultimately, the range of different interventions here at different levels have led to an improvement in air quality. At the local level, a council's programme of improving public realm and cycling infrastructure for providing access for people to take their children safely to and from schools by introducing school streets has helped to accelerate the modal shift away from private vehicles. And projects putting in electrical power supplies for ice cream vans or for canal boats has helped to provide a practical opportunity for people to move away from diesel as a source of electrical power in some fairly niche settings that otherwise may have been missed. And we've seen that this has led to results. When we look at outdoor air quality on Euston Road, which, as I said, was one of the most polluted environments in the UK, we've seen that the level of NO2 is now almost compliant with the 40 microgram legal limit for NO2 in 2024. I think if you'd spoken to any air quality professional 10 years ago and said that that would be possible, I think they would have been very surprised and sort of doubted that. 10 years ago, we were more than double the legal limit. So there's been a huge reduction in nitrogen dioxide pollution on Euston Road. And for particulates, we're compliant now with the 10 microgram limit, which is the annual mean concentration target for the UK, that we're trying to meet by 2040. So we're already almost 15 years ahead of schedule with that target. So there's been a huge improvement in outdoor air quality. And it's not just in Camden. We see this elsewhere in the country as well. So this is overwhelmingly positive. In 2014, 1/3 of all NO2 monitoring sites in the UK exceeded the legal limit for NO2. In 2024, less than 2% of those sites exceeded that limit. And there's been a lot more monitoring sites installed in that period of time as well. So overwhelmingly, we're now compliant with the legal limits for air pollutants in the UK. And in fact, the most recent report looking at the Environmental Improvement Plan for the UK was published just 2 days ago, looking at whether or not, or the number of sites that were compliant with the PM 2.5 target. And the vast majority of sites have already met that long-term annual mean concentration target. So we might be led into a feeling that the issue of air pollution, we're sort of well on track to solving it based upon the legal limits for the UK. But I think all of us in the room will know that's not the case, and it's very clearly highlighted in the Royal College of Physicians report, A Breath of Fresh Air, which was published on Clean Air Day a few weeks ago, which has reinforced the idea that still a huge number of premature deaths each year are caused by exposure to air pollution. And fundamentally, I think the idea that there is no safe level of exposure, this is something the World Health Organization has said for a long time, and I think we're starting to see that more embedded in our sort of strategic thinking at sort of governance level. But the idea is that it doesn't matter if we've met legal limits, it's still always going to be worthwhile for us to try to do more to reduce pollution further, and thinking about not just outdoors, but indoors as well, where people spend the majority of their time. It's also, really drilling into the idea that we know there is a significant health equity aspect to all of this. The data I showed earlier on and sort of, the RCP very clearly emphasises the fact that minoritized groups are disproportionately affected by exposure to air pollution, and that's regardless of other socioeconomic characteristics. There's lots of evidence now specifically looking at the associations between indoor exposure to air pollution and health outcomes, some of it in the home environment, some of it in the school environment, but ultimately we find that higher exposure to air pollution indoors can lead to higher usages of asthma-related medication. It can reduce children's attainment at school or cognitive development as well. So it's not surprising. I don't think anyone would be surprised by this stuff. But there is, an ever-growing pile of evidence that backs up the idea that we need to really do something about the indoor environment. And this was a really interesting piece of research that we supported in Camden a few years ago. So it was led by Rob Metcalf and Seffi Roth. But they had a random sample of households in Camden where they gave them small indoor air quality sensors and looked at people's response to being able to see a sensor display of indoor air quality concentrations in their homes after a bit of prior analysis. Ultimately, what they found was that before sort of giving information about reducing exposures, unsurprisingly, the level of exposure indoors was a lot higher for the lower income households that participated in the study. So that's thought to be because of people living in smaller accommodation. So there's just less volume of air for a given amount of pollution to disperse into. So there's a higher concentration of pollution that people are breathing in on a regular basis. But interestingly, they also found that there wasn't really much of a strong association between outdoor air quality and indoor air quality within the homes that participated in the study. So, you could live in a home in a really polluted part of Camden but still have okay indoor air quality, or you could live in a home that was actually in a really clean part of the borough but have really bad indoor air quality. So it points to the idea that what happens in the indoor environment is really consequential for what we breathe in our homes, but that socioeconomic characteristics are hugely influential in determining an individual household's exposures to air pollution indoors. So just to finish a couple of slides then about what in Camden we're trying to do about this. Certainly we do not have all the answers to the problem. We're just, I think we're quite, we recognise that it's a constant process of learning and trying to figure out what we need to do better about this. But fundamentally, we've learned that better public awareness and understanding about air pollution in general is good. That research project that took place in Camden found that where people could see indoor air quality sensor data, they changed their ventilation habits that led to quite a significant reduction in their PM2.5 concentrations in the homes. So we started up a Sensor Loan project in Camden where anybody who lives in the borough can borrow an indoor air quality sensor for a while, learn a bit more about what it means for their health and hopefully take some action. And we found from survey responses that people tend to feel more confident and able to do things to protect their own health. We need to create more channels of communication using trusted messengers. So people typically don't trust councils or authority people related to any kind of level of government. So working with the NHS, working with other trusted messengers to get the important information out there, I think we see as being really crucial. But fundamentally, we can't absolve ourselves as a housing provider, as a local authority, from the fact that we need to try to reduce emissions at source. So Douglas has already talked about the huge contribution of gas cooking indoors to air pollution. So we're looking now at what we can do to support particularly vulnerable households, degas the cooking activities as just one of the ways to try to reduce exposure in the indoor environment. And crucially, we need a really effective joined up approach that thinks about the need for retrofitting, but also, as we've heard, the fact that that can only and should only be done when thinking about the fact that the indoor environment needs to be improved. Otherwise, we're just locking in problems for future generations. We have our strategy for air quality in Camden has a long-term vision of meeting the World Health Organization limit. So we have this overarching concept of Camden should be a borough where nobody gets sick because of the air they breathe. It doesn't matter whether it's outdoors or indoors, it's just a defining principle for our work. We've adopted the World Health Organization guidelines. We have a series of action plans setting out what we're trying to do to meet that, that long-term vision. But fortunately as well, climate action and air quality is very much baked into other sort of corporate strategies within the borough. We're not just one small team trying to fight for, having our voices heard above a crowd. We're lucky that climate action and air quality features as part of the borough's health and wellbeing strategy. So the ideas around best start to life, growing old, well and living well in Camden has at its core the idea that we need a healthy climate, a healthy environment in order to do that. And similarly with the council's corporate strategy, there's lots in there about housing and sustainable economy, about people feeling connected and sort of interconnected with each other. And a good environment and a healthy environment is very much at the heart of that. And I think for any authority or any level of government trying to address climate risks or air quality or whatever it may be, having that degree of strategic buy-in is absolutely fundamental to making change. And just to finish really briefly, the challenge of housing, I think, and we'll get onto this a bit more in the discussion, I think, but housing is probably, as I see it, where it all starts for all the reasons we've heard today. Local authorities do have expansive programs for retrofit, but there's a huge imbalance between the cost of retrofit and the money available for it. So in Camden, I think the cost we estimate as being about 4 times the amount of money we have available. And the cost of retrofitting all the council properties in the borough is more than £1 billion, which we just don't have. But there's also issues with expertise, time, materials, various other things that make it a challenge to try to provide safe and healthy housing for people who need it in the borough. But it's also not just a case of dealing with problems with old properties. There's a report recently from government, I think a post note, that found that I think upwards of 80% of new homes built didn't meet the Part F regulations for ventilation. So it's not just about dealing with old properties, but we need to look fundamentally at making sure any new builds also fulfill the requirements, just the standard requirements for ventilation. And we need to make sure that air quality isn't just left as a peripheral thing in the world of public health and environmental thinking in the UK. So yeah, that's interspersed all these with some pictures of the various different archetypes of housing that we have in Camden, and that is part of why it's such a challenge. We have so many different types of buildings. Half of Camden is conservation area, so it's an enormous challenge. So I've finished on a bit of a bleak note, I think, but but partly because I think we can get into some of the positives and the opportunities in the discussion session. Okay.